I understand there's some traffic, so some of our ministers are stuck in traffic, but because we have to maintain quite a tight timeline, and of course, we have His Excellency the Prime Minister of Bhutan, Shering Topgai, who is here, so we will start promptly. Good morning, bonjour, sabah al-khair, buenos dias. It's a privilege to welcome you here today. It's exactly 1 year ago that this partnership was launched, 23rd of September last year. And a year later, we're here. It was not obvious we could be here today. One of our founding partners is no longer with us. So the fact that we came together today is a testament to the importance of this file and why eliminating lead poison from exposure of lead poison to children is critical. The partners here today, all of you here today, have shown that commitment. And over the last 1 year, significant achievements have been attained, and you will hear that today for the rest of the proceedings. This partnership started with the idea of if you want to be fast, go alone, and if you want to go far, go together. It's a partnership of being together. It's a belief that the whole is greater than the sum of its parts. Excellency, Prime Minister, Excellencies, Ministers, Executive Directors of UNICEF and UNEP, on behalf of UNICEF, who's hosting us here today, I welcome you all. My job is to facilitate this event, so I don't have a speech, but I want to leave some thought. Last night, I was looking at trying to say something interesting in this event without having a speech. So what we all do nowadays is to look at ChatGPT and ask questions. So I asked a number of questions. We know 800 million children are impacted, but how many adults are impacted? I realized there is no number. Thanks to the Toxic Truth report with Pure Earth and UNICEF and all the other work that has been done by universities and others, actually, we know the number of children who are poisoned, but we don't know the adults. So ChatGPT could not tell me anything about adults. But then I said, ChatGPT, can you at least tell me, can I make the claim that this is the most important, or this is the most difficult topic that children face that are not known? So ChatGPT said, can lead poisoning be considered the single most widespread impediment facing children globally in terms of sheer numbers? Yes, you can make a strong evidence-based claim that lead poisoning is among the most significant threats to children globally in terms of the number affected. And in fact, it may be the most widespread environmental health threat they face today. It gave me the numbers of number of children out of school, number of children stunted, malnourished, number of children in labor, all of that. And all of that put together, children who are facing lead poison actually is far more numbers. So ChatGPT concluded, now we'll stop here. You can reasonably claim, ChatGPT told me, lead poisoning is the most widespread environmental health threat to children worldwide, affecting more than 800 million, thanks to the work we've done. More than malnutrition, infectious diseases, education, and conflict. No other single hazard impairs so many children so silently and so irreversibly. So all of the other work that we do globally, unless this base issue is not addressed, all the other will not yield the results we claim. So the kind of claim would be accurate, evidence-based, and ethically important. So to conclude. So without much ado, I would like the Deputy Secretary General, who wanted to be with us, but because of the high-level events today, could not be with us today. She has been kind enough, she sends her regrets, and she has been kind enough to give us a video to say quickly about her views and the United Nations commitment to this file.
Cycle of poverty and injustice we are fighting to break, and the cost is staggering. Trillions of dollars are lost each year, but the greater cost is human. Millions of children who will never ever get the life they deserve. When children's futures are stolen, every sustainable development goal, from health and education to equality and growth, is derailed too. The good news is that we know how to stop it. Together with local communities, governments and international partners, we cleaned up villages, treated children, and changed practices. After a campaign spanning more than 20 years, we eliminated leaded petrol. We are now tackling lead paint. And now, through the Partnership for a Lead-Free Future, more than 30 governments and 40 partners are uniting behind one clear goal: end childhood lead poisoning by 2040. This is one of the smartest investments that we can make to ensure every child has a chance to learn, to thrive, and to live with dignity. Resident coordinators and UN country teams are bringing this agenda to life. They work with governments and partners to integrate health, environment, and child protection into national priorities, to mobilize resources, and to align the expertise of the UN system in support of systemic change that protects children everywhere. Excellencies, we have the tools and the partnerships. What we need now is the will to act. Every child deserves a lead-free life. Let's be the generation that really makes that happen. Thank you.
Thank you.
Excellencies.
That is powerful, and the United Nations commitment, including all the UN country teams and resident coordinators, so we will remind them and show them this video. Without much ado, we're really deeply honored to welcome His Excellency, the Prime Minister of Bhutan, Tshering Tobgay. Under his leadership, Bhutan conducted a first national survey of blood lead levels, revealing the scale of challenge. It was not only on communities that are far-flung, but also in cities, and the swift actions that you have taken and your government to protect children from lead exposure. You've set an example, and today it's an honor to have you here, Prime Minister. Your word is yours.
Good morning. Madam Executive Director, thank you for featuring Bhutan in your poster calling for an end to childhood lead poisoning. For those who haven't been Bhutan, that's my country. I was pleasantly surprised. Thank you very much. Deputy Secretary General Mohammed, I want to thank her for this powerful message championing this partnership against lead poisoning. Executive Director Russell, Excellencies, distinguished delegates, I bring to you warm greetings from the Majesties, the King and Queen of Bhutan and the people, my country. I thank UNICEF for convening this event on an issue that too often remains hidden. yet one that touches the lives of hundreds of millions of children across the world. Childhood lead exposure is not only a public health crisis, it is a crisis of equity, justice, and human potential. It silently robs children of the ability to learn, to grow, and to thrive. We know that there is no level of lead in one's body that is known to be safe. You don't need ChatGPT for that. We are here because we acknowledge that there is a global problem. And more importantly, because we know that this global problem has a solution. It is solvable. Many of you may know Bhutan for our commitment to gross national happiness, carbon neutrality, and the protection of our rich cultural and natural resources. But we are also a nation that treasures its children. We place importance on our economy, environment, and governance because it is about our future, and our future is ultimately about our children. It is therefore an honor and my responsibility to stand with leaders who share a deep commitment to protecting the lives and futures of our children. Over 30 years ago, Bhutan was one of the first countries to sign and ratify the Convention on the Rights of the Child. Since then, we have made remarkable progress in child survival and reaching the SDG targets. We have reduced infant mortality from 90 to just 15 deaths per 1,000 live births, raised primary school enrollment to 88% and achieved nearly 98% youth literacy. Today, our development strategy remains firmly rooted in ensuring that every child and every young person survives, thrives, learns, and is protected from harm. As His Majesty the King has said, and I quote, "Bhutan is a nation full of promise and potential. We have the security and confidence of our own culture and traditions, an unspoiled environment, and most importantly, a young population full of dynamism and promise." In 2024, Bhutan undertook its first ever national blood lead level survey. The findings were sobering. More than 3 out of 4 children aged 1 to 6 years had a blood lead level greater than or equal to 3.5 micrograms per deciliter. In several districts, we have 20 districts in Bhutan. In several districts, more than 90% of children had a blood lead level of 3.5 micrograms per deciliter or higher. More than 90, 9 out of 10 children. Among pregnant and breastfeeding women, 3 out of 5 were similarly affected. We also documented a direct association between higher blood levels and anemia among our children. This was just last year. These findings were a wake-up call, and the government initiated several key strategic actions. First, building evidence. We conducted investigations to identify all sources of lead contamination in the market, from household products to environmental factors. Second, monitoring and review. We are currently reviewing existing regulations on lead and strengthened our market surveillance systems to identify and restrict lead in consumer products. Third, coordination and strategy development. Led by our Ministry of Health, we are bringing together all ministries, academia, NGOs, and development partners for a whole of government, whole of society approach. And UNICEF, you play a very important role in this. This includes developing our first ever national environmental lead regulations and a comprehensive national lead poisoning prevention strategy. Fourth, community engagement. With help from the Ministry of Health and the media, we have deployed national awareness campaigns to educate parents, teachers, healthcare workers, retailers, and communities on household and environmental sources of lead and promoting safer practices to protect our children. And finally, fifth, capacity building. We have integrated a children's environmental health module for our health professionals and trained healthcare workers and ECCD facilitators, that's early childhood care and development facilitators, on basic prevention aspects. Looking forward, Bhutan is committed to eliminating childhood lead exposure entirely. We will build on these actions through a national task force that will set and enforce standards for lead in products, soil, water, and the environment. We will also establish a surveillance system to test blood levels for pregnant women and children, especially in the high-risk areas. And we will continue mass awareness campaigns to prevent lead exposure, alongside education on healthy nutrition for children and pregnant women to reduce lead consumption, lead absorption. We know that global support is essential to succeed at scale. That is why we joined the Partnership for a Lead-Free Future, to gain access to the technical expertise, resources, and partners we need to take action. And that includes with many of you, partners in this room. What we've proven is this: small nations can lead on big problems when we combine evidence with action. Bhutan is among the few countries globally to conduct a nationally representative blood lead level survey. And we turned the results into a comprehensive national response in months, not years. This rapid, coordinated response can serve as a model for other countries, and it deserves global support. It deserves your support. With the right investment in testing and prevention, we can change our country's narrative entirely. Bhutan can become not only a carbon negative country, as it is. This is our credentials in terms of climate action. But not just carbon negative, but also the first country to be declared lead-free. Excellencies, if Bhutan can move from discovery to action in months, then together we can move the world towards a lead-free future. We are here today, governments, partners, advocates, because we understand that there can be no lasting progress unless we act jointly and we act swiftly. We can prove that no nation is too small and no child's future too unimportant to protect. To country representatives in this room, I urge you, make lead a priority. Take immediate action and raise your voice in every international and regional forum. Together, we can ensure that children of this generation and generations to come will grow up free from the invisible but preventable scourge of lead poisoning. Thank you, and Tashkile.
Thank you very much. Now we have the privilege to welcome two executive directors who have shown championship on this file and who have really moved the agenda forward. The executive director of UNICEF, Catherine Russell, and the executive director of United Nations Environmental Program, Inger Anderson. In that order, they will give their remarks. Thank you. Sorry, there are also translations available in French as well, so you can please join in.
Thank you so much, Mohammed, and really thank you, Prime Minister. I really enjoyed those remarks and appreciate them so much. And I love your idea of a small country can do such big things, and that's a great example. So thank you for being here. Thank you to everyone. Welcome to UNICEF House. It's a really important day, and it's a great anniversary of the first year since the launch of the partnership. So to the Prime Minister of Bhutan, honorable ministers who are here representing Bangladesh, Ethiopia, Guinea, and Vietnam, distinguished representatives from Open Philanthropy and Bloomberg Philanthropies, and really to everyone, and especially to my friend Inger, who's here to join us today. Really appreciate having you here. As I said, we're marking the one-day anniversary since the launch of this partnership, and we want to celebrate how far we've come in a very short time. And I think, as someone who's worked in the government and now in the U.S. government and now the UN, it is amazing how quickly this is moving. And I am so grateful for that. It doesn't usually work like that in government, or at the UN. Don't quote me on that. But so just 12 months ago, the world's attention to lead poisoning in children was what we would say is really too limited, too fragmented, and often ignored. Today, thanks to the collective efforts of this partnership, the issue is no longer on the margins. It's moving into the mainstream conversations on global health and development. The reason is quite simple. Lead is poison. No level of exposure is safe. It damages children's brains before they are fully developed. It steals their potential, and it limits their futures. Even the smallest amounts can reduce intelligence, cause learning difficulties, and lead to lifelong losses of up to 12% in low-income countries. This is not just a health crisis, it's a development crisis. 1 in 3 children, as you've heard, worldwide has high blood lead levels. The cost to societies is measured in trillions of dollars every year in lost productivity, in reduced earnings, and diminished growth. And yet, in high-income countries, lead poisoning in children has been nearly eliminated. That this injustice persists in the poorest countries is truly unacceptable. But, as you've heard, this is a solvable crisis. We know where lead exposure comes from: unsafe recycling of batteries, contaminated soil and dust, lead-based paints, unsafe cookware, spices, cosmetics, and water systems. And we know what works: strong regulation, surveillance, and enforcement, cleanup of toxic sites, safer industries, empowered communities, and stronger health systems. That's why the Partnership for a Lead-Free Future has launched 1 year ago, excuse me, to align our expertise, our resources, and our influence, and to turn proven solutions into global progress. Over the last year, the Partnership Secretariat housed here at UNICEF has been very busy connecting partners and building knowledge. We launched a global knowledge hub featuring the first ever map of lead prevention activities worldwide. We convened regular webinars, country consultations, and technical exchanges to help experts and officials learn from each other's experiences. And with strong input from many of you in this room, we have been developing a toolkit to end childhood lead poisoning, a practical set of guidance and best practices to help countries act faster and smarter in eliminating lead risks. But we have much more work to do to achieve a lead-free future for all children. The good news is that we know what works. And today I am proud to share that for the first time, we also know what it will cost to achieve this goal. UNICEF is launching an investment case, a clear, compelling roadmap to end childhood lead poisoning within a generation. For just $1.6 billion over 15 years, about $2 per child, we can collectively cut childhood lead poisoning in half by 2033 and end it entirely by 2040. Achieving this goal will require the commitment, expertise, and action of all partners. This modest investment will catalyze 4 times as much in complementary national investment, creating lasting systems to protect children from lead exposure. The investment case is built around 4 pillars. First, mapping risks and identifying the children most affected. Then strengthening national surveillance systems, regulation, and health responses. Third, cleaning up toxic sites, transforming hazardous industries, and tackling the largest sources of contamination. And finally, ensuring that lead exposure is integrated into health, environmental, and development agendas worldwide. I'm pleased to report that momentum is growing. The partnership now includes more than 70 participants across 55 countries. We are so grateful for rising investment from major philanthropies and development partners, some of whom we will hear from later today. And more data is emerging. Nationally representative blood level surveys are available in growing number of countries, including, as you heard, Bhutan, Bangladesh, Kyrgyzstan, revealing the true scale of exposure and fueling action. And it really is the critical first step, because if you don't know what you have and where it's a problem, you can't really take action. At the global level, the World Health Assembly recently adopted a resolution calling for a comprehensive global action plan on lead, a milestone that underscores the growing commitment to this cause. It's a clear demonstration of the power of political will, evidence-based action, and critically, of course, partnership. And it shows that lead poisoning is a crisis we can end. And in our business, there aren't that many of those issues, so we're very grateful for that. Excellencies, I know we share a vision of a world where no child is robbed of their health, their learning, or their future because of lead. A world where for the cost of a few dollars per child, we can unlock billions in productivity and human potential. A world where ending childhood lead poisoning becomes one of the most cost-effective, high-impact victories in global development. But achieving this vision will truly take all of us: governments, donors, multilateral organizations, civil society, and the private sector. Each has their own role to play. We need your leadership, your resources, and your advocacy. We need you to make this issue a priority in national budgets, in boardrooms, and in global forums. Every child deserves a lead-free future. And with the evidence, the tools, and the partnership we now have in place, that future is within our grasp. Let's sustain this momentum. Let's expand our partnerships, and let's deliver critical investment that will allow us to finish this job. Hundreds of millions of children are depending on us. Excuse me. Together, we can end childhood lead poisoning, and we can do it within a generation. Thank you all very much.
Thank you so much, and good morning, Mr. Prime Minister, Madam Minister, Catherine, colleagues. It's a real pleasure to be here this morning. So in 1910 or so, companies working on the internal combustion engine figured that it would be a real clever thing to add tetraethyl lead to the petroleum. It gave the engine more oomph. It has been a total catastrophe. And it was well known even in the 1910s that lead had an impact on the human brain, that led to interesting diseases, cancer, heart disease, etc., for those who were working with these materials. This was known. And yet we continued to add and use this material as an additive to all kinds of things: batteries, paint, cosmetics, you name it, we use it, knowing very well the impact. And ladies and gentlemen, therein lies a real challenge of additives: cadmium, mercury, PFAS, PBA, bisphenols, and lead. Each of these have an impact on the human brain, on the fetus, or on the developing child. These are the realities that we from the United Nations Environment Programme work with day in and day out. We know that DDT is toxic, yet it is still produced and sold and exported. We understand that cadmium in toys is a real calamity, and yet children's toys have cadmium. And the same, of course, for lead. We were proud at the United Nations to begin a campaign in 2001 to end leaded petrol. It took 20 years, and in August 31st, 2021 was a proud day because the last country pumped the last liter of the last bit of petrol or gasoline into the last car and exited lead from petrol. So today there is no leaded petrol in the world. It took us 20 years. It should, like Prime Minister has determined, have taken months, because cars, last I checked, still roll on the highways with unleaded petrol. And we knew that already in 1922. So it is campaigns like this that enable us to raise the profile of the problem. And that is what you're doing here. We from UNEP, we're not giving up. We have to deal with, obviously, batteries. And let's not just talk about the recycling and the management of these. No, we want different batteries with different content that do not leave this toxic trail. We don't need lead in paint. We know it's very possible to paint without lead. So we have to simply not just talk about the end of life management of an issue that is toxic. We have to talk at the very beginning of production. That is where we come in, and that is why we're so very pleased to work together with our friends at UNICEF. And I really have to thank you for lifting this. We've been on the battlefield for 20 years in a nerdy space of alternatives. But obviously, the more we work together, the more we can go further. But I ask for your leaderships beyond lead, because our children are getting poisoned by many other toxics too. And we can't pick them one by one. Lead is critical, but PFAS is everywhere. Lead is critical, but cadmium is toxic. Lead is critical, but mercury is killing our children. And so as we move forward, let's understand the toxicity of the industrial world in which we live and that we inhabit, which is important. But let's also continue to work, yes, for a lead-free future, but for a toxic-free future. Thank you.
Thank you very much. Now we're transitioning to the next phase of the program. I really want to thank the distinguished colleagues who have given the keynote address, the addresses from the executive directors, the Prime Minister, and I want to once more acknowledge all the ministers who are here. I just wanted maybe at this part to also acknowledge Cooper Burkett.
Every child deserves a healthy start in life.
That was not, I knew I didn't say that. Yes, so that was a wake up. No, actually, while the issue of inequality of this poison, but also we continue to have issues also in advanced developed countries. And I think Cooper Burkett, who's here, who's from this city as a young child who was impacted by lead poison and had gone, and his mom, who's been an advocate in this file. I just wanted to acknowledge them because it's also happening here in New York. So I just wanted to acknowledge that. Thank you very much for the advocacy of raising this issue. I know that the executive directors have other engagements, so I'm mindful of their time. But I just wanted to highlight before we go to the panel of the ministers' discussion that we have a first year progress report that is available, and then you can pick from here. This is the contribution of the partnership, all the partners here, what they have done over the past 1 year. Significant achievement in terms of the progress that has been made. This is not starting from scratch. We have had commitments, resources that have been made available over the last 1 year to the hundreds of millions of dollars that are important. So this report basically showcases national leadership as attested by the ministers here and the countries that are here. It attests to the innovative approaches and the collective values of this partnership. It's a report to read with pride because it reflects your work, your commitment, as well as the real difference being made here. Our job in the Secretariat, a handful of people, is basically to make sure that we work in tandem, we work together, we leverage all of the partners' capacities and resources. The convening power of UNICEF and the United Nations, while combining the skills and knowledge and the expertise at the ground level of every partner. The critical NGO partners, I mean, last night we were at an event with Vital Strategies and Pure Earth, 25 years of this work that they have been doing in some cases, and they are leaders as well as LEAP and others. So it's all the partners coming together that is going to make this a difference. And as we continue to this celebration of progress, we will also hear 4 PLF member countries who have shown significant contribution and achievement over the past year. We also are grateful to have Dr. Paramita Hore of the New York City Health Department, another partner in the Partnership for Lead Future, who will be moderating the discussions for these ministers. So without much ado, I would like to welcome. I see some of the ministers have not still made it due to traffic, but I think because I want to make sure that the executive director as well as the prime minister can take their leave at their pleasure. So we'll go to the next stage, and please let's show the video that shows the contribution of everyone here today.
Every child deserves a healthy start in life. But today, 1 in 3 children globally, around 800 million, are poisoned by lead. The global death toll from lead exposure is high in malaria or HIV/AIDS. Lead also damages children's brains and undermines their lifelong potential. It lowers IQ and has been linked to violent behavior later in life. But we can change this. We know what to do. Now it's time to end childhood lead poisoning. The Partnership for a Lead-Free Future is mobilizing action across more than 70 partner organizations. It has launched an online global hub for country-led action, with a first-ever map highlighting lead projects around the world. The partnership hosts key resources, including a toolkit to end childhood lead poisoning to support national action, with guidance from case studies to videos. We know what works. Surveillance to find where lead poisoning is, remediation of contaminated sites, regulatory enforcement, communication to raise awareness, and health systems to protect children. By making modest investments, we unlock extraordinary returns. Ending lead poisoning is one of the highest value wins in global development. With political commitment and just $2 per child, or 15 cents per year, we can end childhood lead poisoning by 2040. A lead-free generation is within our reach.
Good morning, everyone. You can hear me. Hello. It's quite a privilege to be here today. But to start, as others have said, lead poisoning is a preventable public health issue. And there have been a lot of work done by the New York City Health Department to address lead exposures across the city, impacting New Yorkers. But some of this work have also guided and initiated intervention strategies globally. And to say what Prime Minister said, there is no country too small. There is no city too small. We're all in it together. So today it's a great privilege to be here with dignitaries from around the world. Thank you all for joining. They will be sharing some brief remarks with us. Dr. Mekdes Daba, Ministry of Health in Ethiopia, couldn't join us today due to New York City traffic, but we do have, I'd like to start with you, if I may. Yes. Honorable Nurjahan Begum, Advisor to the Ministry of Health and Welfare for the interim government of Bangladesh. Bangladesh has recently included lead data in its multiple indicator cluster survey. How will that data be used to inform a whole of government approach to achieve the goal of a lead-free Bangladesh?
Thank you, distinguished colleague and everyone. This year, Bangladesh achieved a critical milestone by integrating blood lead level testing into the 2025 multiple indicator cluster survey. For the first time, we now have nationally representative data on children's exposure to lead and other heavy metal collected from around 14,000 children and pregnant women across all 64 districts. This is a groundbreaking step because without robust data, the scale of the crisis remained underestimated. We already knew from earlier studies that lead poisoning in Bangladesh is widespread and severe. Seviers in Dhaka and 4 rural districts revealed that almost 100% of the children tested had detectable lead in their blood, with 40% at very high levels. This finding made Bangladesh the 4th most affected country in the world, with more than 35 million children at risk. Yet, until now, these studies were localized. The MICS survey transforms that picture by giving us complete nationwide understanding. Why this is useful? First, it will give us nationally representative data with magnitude of problem through identifying the hotspot with the geographical location of exposure and risk factor. Second, it will ensure that children and families identified with elevated blood lead levels can be managed and followed up through health service as planned by the Director General of Health Service. And most importantly, this data will feed directly into the upcoming national strategy for a lead-free Bangladesh, guide government and non-government investment, enforced a strengthened surveillance systems, awareness program, and multi-sectoral coordination from health to environment, from education to industry. With this evidence, Bangladesh can turn aspiration into action, protecting children's health, ensuring safe environment, and advancing towards its national goal of eliminating childhood lead exposure by 2035.
Thank you very much for sharing your remarks. If I may pass it on to you, Honorable Charlotte Daffy, Minister for Women, Empowerment, Children, and Vulnerable Persons. In Guinea, how can stronger environmental policies and regulations help reduce childhood lead exposure? And what role should the environmental sector play in creating a lead-free future?
Merci beaucoup. Bonjour à toutes et à tous, honorables invités. Je suis Charlotte Daffy, comme vous l'avez dit, ministre en charge de la promotion féminine de l'enfance et des personnes vulnérables. Et je devais être ici aujourd'hui avec ma collègue en charge de l'environnement, mais puisque c'est une question gouvernementale, je peux vous donner quelques éléments de réponse. Donc aujourd'hui, en Guinée, nous avons une priorité nationale en matière de santé publique. Et l'exposition au plomb est un enjeu silencieux, mais préoccupant, qui interpelle la Guinée dans sa volonté de bâtir une société plus saine et plus équitable. Et donc, la protection des enfants et des personnes vulnérables face aux risques environnementaux s'inscrit dans les priorités stratégiques de notre gouvernement. Et il y a aussi un lien avec la protection de l'enfance et des personnes en situation de vulnérabilité. Les enfants, mais particulièrement ceux issus des milieux modestes, sont les plus exposés aux conséquences du plomb. Nous sommes un pays minier et avec beaucoup de zones minières Et les enfants souvent vont dans les zones minières pour travailler, ce qui est interdit déjà par la loi et avec la protection de l'enfance. Leur santé et leur avenir ne doivent pas être compromis par des risques évitables. Donc, il est de notre devoir de protéger les enfants et d'investir dans l'avenir de la Guinée. Donc, on a aussi des engagements au niveau gouvernemental et au niveau des partenaires. Le gouvernement, à travers le ministère de la Promotion féminine de l'enfance et des personnes vulnérables, réaffirme son engagement à travailler main dans la main avec l'UNICEF et les partenaires techniques et financiers pour mettre fin à cette menace. Nous devons conjuguer nos efforts nationaux et internationaux afin d'éradiquer les sources d'exposition au plomb. Il y a également nous tenons également compte de la dimension genre et équité. Les filles et les femmes et les jeunes filles subissent souvent une double vulnérabilité face aux inégalités environnementales et sanitaires. Notre réponse doit donc être inclusive et sensible au genre. Et aussi garantir un avenir sans plomb, c'est aussi garantir plus d'égalité des chances pour toutes et tous. Il est temps d'appeler à l'action, de renforcer la réglementation, la sensibilisation et la prévention pour protéger chaque enfant guinéen. En termes d'avancée de la Guinée, nous avons déjà montré notre engagement pour la santé environnementale, notamment avec l'interdiction des sachets plastiques et la mise en place des réglementations sur certains produits chimiques. Ces avancées démontrent la volonté politique du pays et offrent un cadre propice à l'extension des efforts de lutte contre le plomb. Mais comme tous les autres pays, il y a aussi des défis qui restent, notamment l'absence de données nationales sur l'ampleur de l'empoisonnement au plomb, et le manque de sensibilisation des familles, des éducateurs et acteurs de santé, les faiblesses de réglementation sur les peintures, les épices et les pratiques artisanales, le manque d'infrastructures pour le dépistage et la prise en charge médicale. Mais avec l'UNICEF, nous sommes en train d'adresser ces questions que je viens de citer. J'avais des échanges juste avant de venir avec la représentante de l'UNICEF en Guinée pour voir comment faire de la sensibilisation communautaire autour de ces questions, parce que justement, c'est dans les zones, dans les communautés que les enfants sont le plus exposés, mais les questions sont en train d'être adressées avec l'accompagnement des partenaires tels que l'UNICEF et d'autres partenaires en charge de la protection des enfants. Je vous remercie.
Thank you. Thank you very much for your remarks. Hello, Honorable Dr. Vu Man Ha, Permanent Deputy Minister of Health of Vietnam. Based on Vietnam's experience, what do you see as the key priorities to protect children and move towards a lead-free future?
Thank you. Việt Nam đã tham gia Liên minh vì một tương lai không trì vào năm 2024, thể hiện cam kết mạnh mẽ của chúng tôi trong việc bảo vệ trẻ em và tạo dựng môi trường an toàn hơn trong các thế hệ tương lai. Đồng thời chúng tôi cũng nhận thức rõ ràng rằng là vẫn còn nhiều thách thức và cần có thêm những hành động cụ thể.
Ladies and gentlemen, Vietnam had joined the Partnership for a Lead-Free Future in 2024, showing our strong commitment to protecting children and creating a safer environment for the next generations. At the same time, we recognize that many challenges remain and more action are needed.
Trong thời gian tới, chúng tôi sẽ có một số ưu tiên quan trọng để bảo vệ trẻ em trước nhiễm trì. Thứ nhất là chúng ta cần một cái hệ thống giám sát quốc gia để theo dõi thường xuyên nồng độ trì máu. Hiện nay dữ liệu còn rất hạn chế, trong khi những cái nghiên cứu đã có cho thấy tình trạng đáng báo động. Giám sát thường xuyên sẽ giúp xác định các cái điểm nóng và đưa ra các cái giải pháp kịp thời.
Based on our experience, I see several key priorities for protecting children from lead exposure. First, we need a national system to regularly monitor blood lead levels. At present, data are very limited, but the studies have already shown alarming results. Regular monitoring will help identify hotspots and guide timely actions.
Thứ hai, chúng ta cần phải giảm các nguồn phơi nhiễm chính. Ở Việt Nam thì bao gồm sơn, có chì, thuốc cổ truyền, đồ chơi và đặc biệt là các hoạt động tái chế ắc quy tại các làng nghề cần có các cái quy định chặt chẽ hơn, đồng thời hỗ trợ cộng đồng tìm kiếm sinh kế an toàn và bền vững hơn.
Yes. Second, we must reduce major source of exposure. In Vietnam, this includes lead paint, traditional medicines, toys, and especially battery recycling in crafts village. Stronger regulation are needed, but at the same time, communities also need support to find safer and more sustainable livelihoods.
Thứ ba, chúng ta nên thiết lập và củng cố các phương pháp tiếp cận đa ngành giữa các bộ liên ngành, Bộ Y tế, Môi trường, Thương mại và Công nghiệp, Giáo dục và Tài chính, đất đai và thống nhất các cái phản ứng cụ thể theo từng ngành.
Thirdly, we should establish and strengthen multi-sectoral approach between relevant ministry, health, environment, trade and industry, education, finance, and land management, among others, and agree sector-specific responses.
Thứ tư, chúng ta nên tăng cường năng lực của hệ thống y tế để bảo vệ trẻ em khỏi phơi nhiễm chì thông qua việc xây dựng năng lực cho nhân viên y tế và cung cấp trang thiết bị thiết yếu và thuốc men để quản lý ngộ độc chì.
Fourth, we should strengthen the capacity of health system to protect children from lead exposure through building capacity of health workers and supply of equipment and medicine for management of lead poisoning.
Thứ năm, cần tăng cường truyền thông và nâng cao nhận thức. Nhiều gia đình chưa hiểu đầy đủ về nguy cơ của chì, trong khi cán bộ y tế cơ sở thiếu hướng dẫn và phát hiện và xử lý sớm. Với thông tin rõ ràng, dễ hiểu, cộng đồng có thể chủ động bảo vệ con em mình tốt hơn.
Yes. Fifth, awareness must be improved. Many families are not fully aware of the danger of lead, and local health staff often lack guidance on how to detect and manage cases. With simply and clear information, community can take steps to better protect their children.
Cuối cùng, dinh dưỡng cũng cần được coi là một giải pháp. Bằng chứng cho thấy thiếu sắt, kẽm hoặc canxi có thể khiến trẻ em hấp thụ chì nhiều hơn. Do đó, cải thiện chế độ ăn uống của trẻ không chỉ giúp giảm thiểu tác hại của chì mà còn nâng cao sức khỏe tổng thể.
Finally, nutrition should be part of the solutions. Evidence shows that deficiency in iron, zinc, or calcium can make children absorb more lead. Improving children's diet will not only reduce the harm from lead but also strengthen their overall health.
Với những ưu tiên này, cùng với sự hợp tác chặt chẽ ở các cấp quốc gia và toàn cầu, tôi tin tưởng rằng có thể bảo vệ trẻ em và tiến hơn một tương lai không chỉ ở Việt Nam. Thank you very much.
With these priorities and with strong cooperation of both national and global levels, I believe we can protect our children and move toward a lead-free future in Vietnam. Thanks so much.
Thank you very much for joining us here today. It is heartening to see that countries are taking actions towards eliminating lead exposures. We must work together to eliminate this preventable health problem. So thank you.
Thank you very much. We have this on. Thank you very much. Thank you, Ministers, Excellencies. The Minister of Health of Panama also joined us, so I want to acknowledge her as well. So now this is the last part of our program where we have a fireside chat, and to our two of our key first members of our steering committee of the partnership, but also the philanthropies that really have shown commitment in the long run to really see how this file goes far. And I've mentioned at the beginning that a key founder of this partnership is no longer available. And I think without this global effort to really move this agenda, this would not be possible. So I'm glad to welcome from Bloomberg Philanthropies, Jessica Layton, as well as from Open Philanthropy, Tom Hurd. Please come join me on the. And of course, with me here is my colleague who just joined the partnership, who is our lead technical advisor, Angela Bandemar, is also here. So she will help me with moderating the questions to this event. They are friends of mine, so I felt sometimes when friends ask questions, maybe we're light with each other. So I asked the technical person in our team to ask the tough questions so that I can be the nice guy and Angela can play the hardball. So over to you, Angela. So Angela did not know until now that she was going to do this, but this is a last-minute change of plans. But I'm going to be here with you.
Thank you. Thank you, Abdullah. This is my test. I just have the job and now this is the test. So good morning, everyone. Angela Bandemar. I've just joined the Secretariat. I'm very glad to be here. I consider Tom and Jess friends. Maybe we're friends. So
absolutely.
Hopefully this will be a friendly discussion and we can wrap up this wonderful day of excellent discussions and hearing from the leaders and countries, the ministers. It was very excellent to hear what's going on. And so now we're going to turn to how we're going to do this, how we're going to find the resources to make these activities happen. And so you're from philanthropies. We have Tom Hurd from Open Philanthropy here. We have Jess Layton from Bloomberg. Welcome. We're very glad to have you both here, and we're very appreciative of the funding that you've been able to bring to the table. So I have a question for you both. It's the same for both. So philanthropies receive countless requests to fund important causes. Why have you chosen to invest in lead poisoning? Who would like to start? Go ahead.
Sure, I'll start. Thank you, Angela. Yeah, I'm from Open Philanthropy, and at Open Philanthropy, our mission is to help others as much as we can with the resources we have to maximize the impact through philanthropy. And we think the most important decision as part of that is the choosing of the cause. We launched the Lead Exposure Action Fund this time last year at UNGA, just like the partnership's launch. It is over 100 million in philanthropic funds from over 10 philanthropies. And we launched that because lead scores extremely highly on our three key criteria for an important cause. That's importance, how many people it affects, neglectedness, how much funds there are associated, and tractability, how solvable it is. So I'll touch briefly on a few. We've already heard a lot about how important lead exposure is. We've heard 1 in 3 kids globally have elevated blood lead levels. That's 1 in 2 children in low middle income countries. I think we should consider lead a silent tax on human capital. When you think about the effects it has on childhood brain development, educational outcomes, decreasing productivity that costs trillions in GDP each year across the world, as well as the harm across the life course with millions of deaths annually as a cardiovascular disease risk factor, leading lead to be one of the top 10 causes of death, according to the IHME Global Burden of Disease. We also heard a lot about how neglected it has been as an issue. When we started this last year, we would say that lead kills more than HIV and malaria combined, but receives more than 1,000 times less funding. That's changed a little bit, but not enough. But most importantly, I think to us in our decision to invest in lead, and why I think others should invest in lead, I think is that this is a solvable problem. We've already heard how preventable this issue can be, and high-income countries have proved this. Here in the US, since major regulations started being passed in the 70s, there's been a 96% drop in the median blood lead level. We also see early wins in low middle income countries. We had a representative from Bangladesh, so it's fantastic to hear. They had lead adulteration to a high level in their turmeric, where it was used as a brightening agent in spices. With research, advocacy, and implementation, we saw the elimination of lead from spices in that country. And based on our estimates, we think that might have saved somewhere in the region of 20,000 lives, and for around $100 per life. So to put that in context, we think highly cost-effective global health interventions, things like distributing malaria bed nets, do extremely well if they're saving a life for $5,000, $6,000 per life. And this was less than $100. So very high return on investment. And this also showed that targeting the right lead exposure source in the right population leads to big wins. But I think importantly, approaches can scale nationally. So in the country of Georgia, surveys revealed the extent of blood lead levels, and following action from government and NGOs, including some of our grantees in this room, led to a 60% drop, we think, in blood lead levels over 4 years. And that approach of surveying first and moving forwards is being employed now in Bhutan, as we heard from the president, Bangladesh, and beyond. We're excited to support more of that approach. So yeah, time and again, I think removing the source and the blood lead levels fall really fast. So why 1 year on from our launch, collective launch? I think this is a perfect time to join the effort. I think the momentum is real. We've heard that word momentum many times. I'm extremely excited to have Jessica here and have Bloomberg's fantastic commitment to funding lead work stand alongside us. The PLF membership is expanding, as we've heard. Earlier this year, the World Health Assembly passed the first resolution on lead, so the WHO is required to have an action plan. And we see many committed, fantastic grantees in the room doing great work. But there's still a funding gap, a large funding gap, and action gaps. The good news, I think they're achievable to fill those gaps with incredibly high returns on investments, as I've already said. But I hope it's clear that if you're a government or a donor investing in health, education, or productivity and growth, you can't afford to ignore lead exposure. I think the next step, I hope that LEAF and other philanthropies that are joining us can lay the groundwork for some of the work in this area through measurement, mitigation of the main sources, and mainstreaming awareness of the problem. But governments must act to measure blood lead levels, to identify the sources, and regulate and enforce the removal of lead from people's environments. We also need donors to support that action. So yeah, in closing, I'd like to thank Angela, Abdullah, and the PLF, and all our distinguished guests, and who have been important. The PLF, we know the reason we were excited to fund the PLF is to accelerate some of this momentum into action. So I'd like to invite governments here, if you're interested in setting priorities, and donors here hoping to maximize the impact of their investments, to join us in a collective action to eliminate lead. Thanks.
Thank you, Tom, for that overview. And I will turn to Jessica for Bloomberg's view.
Thanks, Angela. It's terrific to be here and with all of you. I am really excited to share the work of Bloomberg Philanthropies' new investment to address lead poisoning globally. But first, I want to acknowledge all the work that went into this beforehand. The great accomplishment of Pure Earth and UNICEF in the development of the Toxic Truth Report, they really highlighted the importance of lead and put it on the map. We also know, based on data from the Institute for Health Metrics and Evaluations, that 3.5 million adults die of lead exposure each year. So those are huge numbers. But until 2024, only $15 million was provided in philanthropic funding. So there was really nothing at that time. I was honored to participate in the Center for Global Development's work group, along with you, Angela, and others. And the working group really highlighted the importance of investment in addressing the global burden of lead poisoning, and it called upon policymakers, donors, and countries to end childhood lead poisoning by 2040, and that's what our goal is today. I also want to acknowledge UNICEF and USAID for highlighting the importance of lead on a global scale. And then to Open Philanthropy's first step to raise over $100 million in funding. So to answer your question directly, why did we decide to invest in lead poisoning? We have basically a number of criteria that we use to determine what we want to invest in. One is that there's a high burden. Two is that there's an unmet need. And three, that there are proven solutions. And clearly, lead meets all of these three things. And that's why this year we actually committed $250 million for over a 5-year period to address lead globally. Our program's approach is really to build capacity of governments, both the Ministry of Environment, Ministry of Health, and also other ministries as needed. We work with global partners, and we work across 3 strategies: strengthening surveillance, identifying and removing key sources of lead, and then helping governments to develop their lead prevention policies and strategies. Our initiative is focused in 9 countries across Asia, Africa, and Latin America. And we have a very close relationship with Open Philanthropies and the PLF. And really, all of that can ensure our collective far-reaching impact for lead poisoning elimination. We're investing $250 million. It sounds like a lot of money, but based on UNICEF's new number, it's really a drop in the bucket. It's really important for countries, philanthropies, industry, and others to really come up to the plate and support lead poisoning prevention. So we look forward to working with all of you to attain this goal.
Thank you very much to both of you. Very inspirational to hear about what you're thinking of and what has led you to invest in this. I'm going to turn to our moderator now to end the session and bring us home.
So please do stay. I just wanted to it's not on, yeah. The Vice Minister of Vietnam, but also all the governments that have joined us today, all the partners who've joined us today. But I also want to acknowledge the team behind all of this. So Amy, why don't you come up? Where is Lynn? Where is Abid? Everyone, all the colleagues. Come. They're not used to being thanked, I think, but yeah, come. This is not Angela. I mean, I think we have a lot of volunteers you've seen today. Brett. So I really want to acknowledge the team that have done a fantastic job over the last few weeks, really, to get this going. I want to acknowledge all the partners. Without you, the partnership of Lead-Free Future does not exist. We are to provide services to you. We are to make your work easier, but also collaborative. It's a partnership is never easy. But I think it's a hard work that pays off. And I will conclude perhaps with the idea of, if you want to go far, go together. I also want to acknowledge Dr. Paramita Hore, who has really stepped in to also help. So I hope next year, and I also great to see some future partners, we hope. Those of you who have not joined, countries that have not joined, please do join. Institutions like CDC Foundation look forward to also having you join. I mean, the partnership is quite long, and I cannot list all of them, but of course, I want to acknowledge all of the colleagues whose work has really made this effort worthwhile to push. So thank you very much, and I look forward to further engagement, collaboration, and work ahead. Please, if you haven't met some of the colleagues, please do spend time and shake hands. And colleagues from particularly the implementing partners, please meet up with the ministers who are also here, some of the areas that you're also working in. So thank you very much, and have a wonderful rest of your day.